Post-op day 6 from weight loss surgery, and I'm starting to regret weight loss surgery. I've never been in this much gas pain in my life. So yesterday I ate something for dinner and it was completely fine. My stomach took it, but right now it didn't take it, and immediately my stomach rejected it and it made me throw it back out. And now I can feel like how my stomach is just in pain right now, and I'm in pain. Hoping it passes.
The past couple of days. If you had gastric sleeve surgery, please do not do this, because I just did this and now I regret everything. You're not supposed to drink water before or after a meal for 30 minutes.
This was my hair 3 months after bariatric surgery, when I realized that all of it was coming out. Hair loss is inevitable after bariatric surgery.
My sister died 5 years post-bariatric weight loss surgery. She had surgery in the United States at a bariatric surgery center of excellence, going through and using her employer-provided medical insurance. She went through and completed a 6-month pre-op programming check-in, all the things required by that program to be eligible for surgery. These programs educated her on portion sizes, nutrition, vitamins, not drinking out of straws, empty calories, and dumping syndrome. Unfortunately, her program did not educate her on the risk for transfer addiction and alcohol use disorder post-op. 30% of bariatric weight loss surgery patients will experience some form of transfer addiction, and for 20%, or 1 in 5, the patient will experience some form of alcohol use disorder, regardless of their relationship with alcohol pre-op. My sister drank maybe 6 times a year socially pre-op, and rarely in excess. She died 5 years post-op with a blood alcohol content of 0.48. And for most people in the United States, the legal limit for OWI, or drinking and driving, is 0.08. So she was 6 times the legal limit when she died.
I have a bone to pick with the bariatric community, because why in the world did nobody tell me that a side effect of this surgery would be bad breath? Oh my God. I have literally woken up in the middle of the night every single day since the day of surgery. So I'm 6 days post-op now. So for 6 nights, I have woken up in the middle of the night to brush my teeth because the smell is so bad. Now, apparently it's because you're in ketosis, and so your body is just getting used to just not having any carbs or whatever. But why didn't y'all tell me this? I was not mentally prepared to be dealing with this. Okay, I brush my teeth multiple times a day. I'm like, why is my breath so rancid? Literally. I have all the things that everybody needs. You're cold. You need your blanket. I have on socks. Like all these other things. But nobody mentioned a bad breath.
I'm gonna get a bypass. Well, that's kind of what I want to do right now, just because of my acid reflux. It's gotten a little out of hand, girl, like a little too out of hand. I've done every remedy in the book to eliminate it, but it nothing is working and nothing is helping. So I brought it up to my primary the other day, and it's looking like in my head that way because there's no other alternative. And I feel like I've heard a lot of stories where the gastric sleeve turns into a revision to a bypass because it's a side effect that comes along with the gastric sleeve. And not only do I suffer it really badly, the hubby suffers it really bad too. Some people don't suffer with acid reflux at all, which is dope. So my doctor has referred me to another bariatric doctor to take a look and give their opinion. But I also got an appointment to do endoscopy, I believe that's what it's called, where they put a tube and a camera down your throat to see how your stomach is looking. They want to determine is how severe my acid reflux is. So there's grades to it. And so what the bariatric person did tell me when they called me, they said that it's kind of hard to get that approved by the insurance. It has to be a severe level of acid for them to approve a revision to a bypass. But girl, if this is what's gonna help me get rid of my acid, at this point, I will do what it takes. I am tired of taking medicine for it, and I'm also tired of it affecting me throughout my whole day, especially at night. Like, I wake up and I have like severe acid even if I take my pills sometimes.
So I want to talk about something that a lot of people don't share about weight loss surgeries. They talk about it like it's the easiest thing in the world. And when I say weight loss surgeries, I mean gastric sleeve, VSG, gastric bypass, whatever version of it. Everybody's talking about how amazing it is, how it changed their life, how they wish they did it sooner. And look, for some people, that's true. I'm not here to tell you it's all bad, but what nobody really sits you down and talks about, at least not in a real way, is what happens after. Not the 6-month glow up, not the I fit into a size 6 now video. I'm talking about years later, the complications nobody wants you about, the regret that creeps in when the excitement wears off, the stuff that doesn't show up in a 30-second clip. But here's the thing, this is a major surgery. People forget that. They see it as this quick fix, like getting your teeth whitened or something, but you are literally having a huge chunk of your stomach removed and stapled shut. Or in the case of bypass, your whole digestive system gets rerouted, and that is permanent. There is no undo button, or if there is, it's another surgery. More risk, more money, more recovery. And I think a lot of people go into this not fully understanding that. They see the weight loss, they see the confidence, they see the new wardrobe, and they don't see the person 3 years later who can't drink a full glass of water without pain, or who's dealing with vitamin deficiencies so bad they're getting infusions, or who lost the weight but gained a whole new relationship with food. That's honestly kind of scary. So in this video, I want to go through some real stories, people actually living this, actually talking about their experience, the good and the really hard parts. And I'm going to break it down after, because I think there's a bigger conversation here about why this surgery gets sold to us the way it does, and what happens when the reality doesn't match the fantasy. So stick around, because the second half of this video, after you see these clips, is where I get really into it. But just a side note, creators' handles are in the description box below, so go give them some support. Now, let's watch.
Hey guys, so I have not been doing so well. Last Monday, I had a blood clot go to my lungs, a pulmonary embolism, a PE. I almost died. Had to stay in the hospital. That Monday, Tuesday, Wednesday, got out Thursday. Once I came home Thursday, they had me on blood thinners and all sorts of stuff. I couldn't keep water down. Couldn't drink water. I'd take a drink of water, I'd throw up. Take a drink of water, I'd throw up. It was really bad. So I tried to maybe suffer through that, but on Saturday morning, I just couldn't do it anymore. So I went back to the emergency room, and they admitted me, and they found that my stomach has developed a leak. What that means for me is I can't have anything in my mouth for 6 weeks. So they have placed a feeding tube in my nose while that heals. Once that is healed up, then I start from square one. I'm back on a liquid for 4 weeks. And then we'll go from there. But it's not been a good time. I'm having to take some time off work. It's been really tough. I've a lot of pain. They had to install a drain in my side, which hurts a lot. Just been in the hospital, which if anybody's ever stayed an extended amount of time, it's just not the most comfortable things. Dozens of blood draws and IVs and different things, and it's just not been nice.
Hey everybody, I just wanted to do a video because I always said that I would be completely transparent and honest about my gastric sleeve experience, and I I'm not gonna lie, I have been feeling a lot of regret lately, and I have been struggling quite a bit. So let's get into it. Don't get me wrong, I am obviously very happy to be losing weight, but I have been struggling a lot. I feel like the gastric sleeve has genuinely sucked every single bit of happiness out of me. It sucked out all my energy. I'm so tired all the time. I'm so fatigued. I'm so malnourished to the point that I'm literally so weak that I just want to lie in bed all day. I'm constantly blacking out. I'm lightheaded, so tired all the time, so weak, and I really miss my life before I had gastric sleeve. I researched the gastric sleeve for a good 1.5 years before I booked it, and I have been aware that you're going to have ups and downs, and you know, your serotonin levels drop significantly, and so your depression can come back with a vengeance. I knew all of this. I knew it wasn't going to be an easy journey. It's definitely not an easy way out. The people say that it is. It's so mentally and physically hard. I just miss my old life.
Hi, this is going to be story time part 1. Very quickly, my name is Brittany, and I wanted to talk about my bariatric surgery experience and complications I've had since. I'm going to make this very clear. I'm 100% pro bariatric surgery. I just believe that everybody needs to do their homework and their research beforehand on what doctor and what facility you have it done, specifically in or outside of these states. So just to make that very clear, this is my personal experience. This is not reflected off of anybody else or you know, any other jabs at the surgeon who did mine. This is 100% my experience from start to finish. In February of 2021, I had a mini gastric bypass revision. Previously, years ago, I had had a sleeve, but I had this surgery done by Dr. Gutierrez at Mexico Bariatric Center in Tijuana, Mexico. And the reason that I did that was, one, many people in my area had surgery at that facility with that specific doctor, great success rates, no issues. It was all good. And I actually ended up going with a friend of mine. Another big reason that this particular place was chosen is cost. Very vague. Do not quote me on this. You're looking at roughly 15 grand, give or take some, to have bariatric surgery in the States. To have the surgery that I had done in Tijuana, Mexico, including flight there and back, was $6,500. Let me stop you. Yes, that is an amazing savings. But remember, quality over quantity. What you save now could cost you more in the long run. And that's exactly what happened with me. We fast forward to June of 2023. I went into the hospital with a distended abdomen, extreme vomiting, unable to keep fluid and solids down for over a week. Severe pain. Very bad. Had a CT scan, showed something not right, and I was immediately transferred by ambulance 2 hours away to another hospital where a surgeon came in and let me know that we were going to have to do emergency exploratory surgery to prepare for best case scenario of an incision from my chest down all the way to the lower part of my abdomen, a possible ostomy bag, a feeding tube in my side, and possible removal of necrotic bowel. We would not know until the exploratory surgery was done and they were in there actually open and looking. By the grace of God, I came out of the surgery and was able to have it done laparoscopically. And it ended up being so much better than the best case scenario that they had given me. They were able to repair everything. There was no necrosis. I did not have to have a feeding tube. I did not have to have an incision down my abdomen, and I did not have to have an ostomy bag. But what was found was, when the surgery was done originally in 2021, when you have a bypass, I'm not a doctor, I don't know the ins and outs of the anatomy of this, so correct me if I'm wrong and don't quote me on this, but basically when a bypass is done, the stomach itself is bypassed. I mean, it's in the word itself. You remove the stomach out of the way, the stomach is to be sealed off, and it just bypasses. What happened was my stomach cavity that was bypassed was never sealed off, and for a year and a half, it created an internal vacuum which slowly pulled in internal organs, caused them to knot up and make an obstruction, which put me hours away from death's doorstep. Now, thankfully, I am okay and I'm here. I'm a young mom. I have 2 kids, and that was the very, 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 very scary moment for me. That hospital stay alone was about $1.2 million in medical bills. Now let's back up. I saved $6,000 to $8,000 by having this surgery done in Mexico. That ended up causing the first hospital stay of about $1.2 to $1.5 million in medical bills from surgery and the hospital stay and the medications that I had to go home on and all of that. But that wasn't the end of it. Fast forward to the next January, and I was in the hospital again for 11 days. Spent New Year's, spent my birthday, all of that for 11 days due to severe ulcers from the surgery.
Okay, hi people. So here's the update on my VSG experience. So on the 19th, as you guys know, I had the sleeve surgery done. Everything was going great. I didn't do the day-by-day post-op, like one day, one post-op, day 2 post-op. I didn't do all that. I was going to wait for a week and then 2 weeks. But upon approaching my week last Friday, I was in pain on my right side. Like everything just hurted. I called the doctor's office. They said, oh, well, just wear the belly band, take some medicine. It's normal for you to feel pain after the surgery. It's just scar tissue. Well, went through the whole weekend taking a pain medicine. None of that worked. Come Monday morning, I was in the ER for the same pain on my right side. Doctors did a CAT scan and they realized I had a massive hematoma on my left side. The doctor kept asking me, did I feel pain on my left side? What was going on? Was I throwing up? Did I have a fever? No, guys, none of that. I didn't have none of that. Do you hear me? Nothing, nada. Okay, so I was rushed from that hospital back to the hospital who did my surgery, because the hospital I was at, they didn't have a GI team. The radiologist wasn't equipped to handle what was going on. So got back to that hospital maybe Monday evening. They did more tests. They gave me pain medicine. I mean, they kept giving me pain medicine. Pain medicine was not working. I had to do emergency surgery yesterday morning. Turns out that the hematoma, fancy word for blood clot, for y'all that don't know, it was pushing, it was big. It was pushing down on my lungs, my stomach, my intestines. The surgeon said I wouldn't have made it to next week. So basically it was going to be a silent killer because I had no symptoms of this whatsoever. They said, my surgeon told me it was like a 20% chance of developing these things after VSG surgery. But hey, who would ever think that you would be in that category, that you would fall in that category? See what I'm saying? But me, just to fall in that category. So they went inside, did the surgery. They had to drain the blood. They drained 1,600 cc's of blood and the clots out of me. They told me they would only go through 2 incisions. Here's the catch part. Not only did they go through the 6 incisions that I already had, I got 4 more incisions. So I have a total of 10 incisions now. He told me that the surgery would take 20 minutes. Y'all, I went to post-op at 11 o'clock. My surgery started at 12 o'clock. I didn't get back to my room till 4 o'clock. So, it was longer than what I expected. The pain was god-awful. It was worse than the first time. You imagine having 2 major surgeries less than like 14 days apart. And when I tell you I couldn't even stand up yesterday, it was hard. I just remember I couldn't even wipe myself. I stayed on the toilet for like an hour because I couldn't get up. The nurses wasn't coming, crying. Like the pain was agonizing, excruciating. Crying, y'all, crying. And it's crazy because, again, listen to what I say. I did not have any warning signs that I had the hematoma, the blood clot. It was like really bad. If a surgeon tells you, the doctor comes in and tell you, hey, it's a good thing you came in, because basically this thing was breaking apart. Like, it was getting ready to travel.
So I feel like I almost had a near-death experience yesterday. I'll show you. Oh, I can't breathe right now. So just for context, that was me after dinner yesterday. We had coconut chickpea curry on some basmati rice. I've had chickpeas before, I've had curry before, I've had rice before. All have sat decently well with me, except I don't think my body liked the idea that I was eating chickpeas last night. So basically I started to feel pain after the first bite, but I didn't listen to my stomach at all. So basically I had a bunch of gas pain starting in my upper abdomen, coming up my back, up my neck, on my shoulders, down my arms. It was actually scary. I was scared. I'm trying to pace around my house, but I'm getting nauseous, I'm getting dizzy. And it's like I needed air, but at the same time, like I had to go sit down. And then I started sweating, like a lot. And then I was like, oh shit, I think I need to puke. I think I need to puke. So I made my way to the bathroom. I'm sitting by the toilet and I end up taking a Tums because that's what I had on hand. And like 2 seconds later, I'm like dry heaving over the toilet. Anyways, while that was happening, my siblings are on the phone with my parents. They're like, you need to take her to the hospital, call an ambulance. Like, I'm sitting there crying and I'm like, no, I'm in so much pain. It was, oh my God, it was so embarrassing, to be honest. And in the midst of all that, of my siblings trying to figure out whether or not they should be taking me to the hospital, it just stopped. Just like that. And you would think this shit had a gradual return back to normal. No, it just stopped completely. Like that shit took the life out of me. I sat on the floor in the bathroom for a good 15 to 20 minutes after, and I was just like, what just happened?
Okay, so let's just, run it back real fast. Now, my cousin got the initial surgery at St. John's Hospital by a gastric surgeon who performed her gastric sleeve surgery. Then she fell ill and she was rushed to Providence Hospital. Providence didn't have any gastric surgeons, so they basically just kept her. You feel me? So now she's at U of M Ann Arbor, where the head of gastric has basically accepted her as a patient. So that's an hour away from where we lived or whatever. Not a problem, we going there. So she's woke now, right? Same funny self, same spirit, but she still just wasn't there or whatever. So after like a few days, they had said that the issue with her was she had blood clots in her legs and her arms, because remind you, you're supposed to be moving around. You get what I'm saying? So she had developed blood clots in her legs and her arms, so they was fighting that. And then she had developed VRE. I believe that's what it's called. VRE is a infection, is a real bad infection in your bloodstream, right? So they was fighting all these things collectively. So after her being at the hospital for a week, like they just fighting these infections and stuff like that, and the blood clots and stuff like that, I had got real sick. Like I had got a real bad cold. So I wasn't finna go up to the hospital. She was in the ICU. But at that time when I had caught the cold, she had actually been moved down to moderate care. So everybody is feeling like, okay, she's doing good. Like she healing. Everything is getting better. Everything is getting better. So I remember I called her sister and I said, what's the new room number? Because at that point I was feeling better, but I definitely wasn't going to the hospital where my cousin is fighting bad infections with a cold. You get what I'm saying? I'm just gonna have to catch up. So she ended up telling me the room number. I'm like, okay, well, I'll be up there tomorrow, right? We all using all this gas. You feel me? An hour is a drive, but living in Houston, an hour not a drive for real. But so the next day, remind you, okay, so this is how I go. The next day, I'm at work, right? I'm planning on going, doing my clients and stuff like that. And then going to the hospital right after I was gonna leave from the shop to go right to the hospital because I had missed my cousin, you know, and all this is going on. Like, what? I'm gonna see my cousin. I'm gonna see my cousin every day that I can. So I got a text message from her big sister, my big cousin Shawana, saying, "Hey, family and loved ones. At this time, we need prayer for Dana. Something, something, something." Right now, it was weird because, you know, I know what's going on, but it's weird because it threw me off, and it made me know something because, remind you, at the beginning, everything was a secret. Up until now, everything was a secret, right? For 2 weeks, everything been a secret. So when I called Taryn, I'm like, why y'all sending out this text message? You know, like, what's going on? So Taryn tells me that basically, this is, okay, Friday, May 17th. This was Friday, May 17th. They sent the text message out. They tried to discharge her Friday, May 17th that morning. But my cousin wasn't walking and she wasn't eating on her own. So everybody said, no, she's not ready to be discharged. Just like that. That evening, she started vomiting, right? My cousin started vomiting. And so when she started vomiting, they took her to do a CAT scan. And in a CAT scan, they seen, this is all, I want y'all to understand, this is all while, this is like 9-10 days. This is, at this point, this is 12 days into being at the best teaching hospital in the region. University of Michigan, Ann Arbor. Go Blue, right? Remind you, the surgeon who took her on is the head surgeon, right? That's why she went there, so she can get a scope, so we can see what's going on in her body while she bleeding, right? Took her to do a CAT scan. They didn't see no, like, movement in her bowel system. So immediately from the CAT scan, they took her into emergency surgery. So I'm talking to my cousin, and she's telling me, like, yeah, they had to do a CAT scan on her. They don't see no movement. They about to take her to surgery. So me being the baby cousin and going through life how I've been through life, I know how to just sit back and form my own analysis, basically, of what's going on. Like, huh? She in moderate care, though. You get what I'm saying? From ICU, she in moderate care. On top of that, she at U of M Ann Arbor, 60 minutes away from 8 Mile. Let me calm down. Let me calm down. It's something. It's the type of anger that you get they don't release for a long time. No matter how much you pray about it, it's an anger that sit on you. And I ain't gonna lie, anybody who lost somebody close to them, it's the type of anger that you get, especially when it's the specific way that they die, you know? So she called me, she said, boom, they about to take her to emergency surgery. My heart beating out my chest, you know? But I'm like, okay, let me hurry up and finish my client. And by the time I finish my client, I'm going to just go boom, boom, boom. Before I finish my client, my cousin Taryn called me back. And she says to me, the doctors did the surgery. They opened her up and they didn't see. They seen that the doctors opened her up and seen that her full large intestine and small bowel had died. And there's no survival rate. Her full large intestine and her small bowel had died, and there's no survival rate. All while in the best teaching hospital in the region now.
So I lost 150 pounds with the help of weight loss surgery, and I have people reach out to me and ask me questions all the time. I've been sharing my journey for 3.5 years, almost 4 years. And I am an open book. So I share the good, the bad, and the ugly. Not enough people do that, and they're not super transparent. So when somebody goes through weight loss surgery and they're feeling these things or these things are happening, they're like, why did nobody tell me that regret was possible, or that body dysmorphia was possible, or transfer addiction could happen? Like all of these things that can happen after weight loss surgery, not enough people talk about. So I had somebody DM me and say she's having sleeve surgery soon, and she has seen me talk about regret. So she wanted to kind of get get more information on that. Regret is something that a lot of people feel, and it is totally normal because not enough people talk about the mental aspect of weight loss surgery. They're just focused on the physical side of it and actual like surgery and the pain from surgery. The mental side is even harder. Okay, some people don't struggle so much with the physical side. They're healed in a few days and they're up walking around, no big deal. For somebody like me, that didn't happen. My biggest incision was super, super painful. So I struggled to stand up, walk around. Sitting up hurt for weeks. So because of that, I wasn't getting enough fluids in and I wasn't getting enough protein in. So I was malnourished and I was dehydrated. Being dehydrated is a big issue. It can cause a lot of things to happen to your body. So I ended up in the hospital twice for fluids. I was severely dehydrated. So then 1 month after surgery, I ended up in the emergency room after almost passing out on the way to the emergency room. Thankfully, my husband was driving and ended up having my gallbladder out. So I had a second surgery within 1 month. Potential complications of surgery can include, well, it's not even a complication, but having your gallbladder out after weight loss surgery is a pretty common thing that can happen. But complications can happen, like a leak or something along those lines. But those are things that your surgeon, if you're choosing the right surgeon and a qualified surgeon, will go over with you. Like, I am shocked at the number of people who don't know all of these things going into it because their surgeon or their surgical team doesn't talk to them about it. But after you have surgery, there's other things that can happen. And again, most of them are mental. So the whole body dysmorphia thing, your brain is not registering that you have lost weight or that you are a physically different person. So in your head, you're still this obese person and you're struggling with that internally. Transfer addiction can happen because we relied on food for so long, but now you physically can't eat that much food. So now you go to something else, drugs, alcohol, shopping, all these things that you kind of just change your addiction to, basically. A lot of us have issues with tailbone pain because of the loss of the padding back there, basically. There's just lots of things that can happen after surgery that not enough people talk about. So when they do happen, people are feeling regret, or they're like, why did I do this? Because it's way harder than people think. So for me, having my gallbladder out, ending up in the hospital and being dehydrated. I even ended up with a PICC line because I hadn't eaten in a week because I was so nauseous. So I ended up with a PICC line.
One thing that is not talked about enough after gastric sleeve surgery is gallbladder issues. My name is Destiny. I am 7 months post-op VSG surgery. I'm down 69 pounds, and this Friday I am getting my gallbladder removed. I made a small comment about this in one of my other videos, and I've gotten a lot of questions, so I wanted to make a full video answering some of those questions. Before you get your surgery, it's pretty well known that it's a possibility that you will develop gallstones due to the rapid weight loss. I didn't think it was gonna happen to me, honestly. So to answer some of your guys' questions, number one, how did I know that I had gallstones? It started with severe stomach pain. So the first time I was at work and my stomach started to like cramp up, kind of like this area here. And at first I thought it was trapped gas. So I got up, I started walking around, and it went on for maybe like 20 minutes and it would not go away. And over time, it just kind of kept getting worse and worse and worse over those 20 minutes. So I went to the restroom, tried to use the restroom, couldn't use the restroom. Walking didn't do anything. I had no idea what was happening. It went away and I left it at that. Second time, I was at work again. I was sitting at my desk, and again I start to feel cramping, kind of like this general area and kind of like to my right side. So again, for like 20 minutes it starts to get worse and worse and worse, to the point where I was literally holding my stomach hunched over. It felt like really sharp stabbing pain on my right side. I was on the verge of tears, and again I walked around my job because I didn't know what was going on. I thought it was trapped gas, or maybe I ate something that upset my stomach, until once it went away, I spoke to one of my coworkers and she was like, do you think it's gallstones? And I was like, you know what, it could be. So I kind of started doing some research, and Dr. Google told me it was gallstones. So I had told myself, if it happens one more time, then I will go. Mind you, this is in a span of like 3 to 4 weeks. So it was happening like once a week at this point. Third week rolls around. I'm at work again, same thing. The cramping starts to form here, but this time it was so much worse. So much worse to the point I started crying. I got up and I went to the restroom. I tried to use the restroom, nothing. And it was just so severe where I was holding my stomach and like I was having like really sharp stabbing pains like on my right side. Underneath my breast, kind of like in this area here, was cramping up really bad, and nothing I did would help me. And it went on for about 20 minutes again. I'm holding my stomach. I feel like I'm gonna pass out. I'm sitting at my desk and I'm like sitting there like this with my eyes closed, just trying to like relax my body and calm myself down because I felt like I was gonna pass out. So I'm sitting there like this, looking up with my eyes closed, just suffering, honestly. And when I open my eyes, I just like see stars and I feel like I'm gonna pass out. And I start crying because my coworker's like, are you okay? And I'm like, no, like I'm not. At this point, I for real was like, no, I'm not okay. Like I cannot do this. I need to go to the ER. So I left work and I went to the ER. So I get to the ER and they do an ultrasound, and basically they tell me that I had developed several gallstones. Fast forward maybe 3 days later, they tell me that I need surgery and my best option is to remove my gallbladder due to me still losing weight. And another question that I've been getting asked is, your doctor didn't prescribe you medication? I was prescribed medication. I was taking Ursodiol for, I think it's like 4 to 5 months or something like that. I think by like around that time I had run out. So Ursodiol is a medication to prevent you from forming gallstones. Once I ran out, I requested a refill from my doctor. I haven't, my doctor just said, take this, it prevents gallstones, and I said okay. So when I ran out, I requested a refill and my doctor denied the request. So I searched up, how long do I have to take this medication for? And it had said about I think it said like 4 to 6 months or something like that, or 3 to 6 months. So at that point I was already like almost 6 months post-op, between like, I want to say 4 to 6 months, I don't remember exactly. So I assumed like that I didn't need it anymore, and I didn't really question it because any of the other medications, like for instance I take what is it called, it's like an anti-acid one to help me with heartburn and acid reflux, and anytime I run out of that one, I just request a refill and my doctor approves it, and I'm able to go pick it up. So this one, I kind of thought the same thing. If I just request it, he'll approve it and I can go pick it up. He denied it, and after the research I was like, okay, well maybe I don't need it anymore, and I stopped taking it. And so I think that is kind of where I went wrong. I didn't really follow up with my doctor to confirm if it was still needed, how long I had to take it for. I just kind of assumed, and that was like, I guess like something on my end that I should have done a little bit more research on. So now, fast forward to present day, now I have a lot of discomfort and I just feel like very uncomfortable all the time. And my surgery is this Friday, so I'm gonna completely remove my gallbladder. And I haven't had another attack since the one I had last week. My surgeon basically told me to avoid any foods that are high in fat. So my thing was that I was eating a lot of avocados. I don't really eat out a lot. I think the closest thing would probably be like In-N-Out. But I don't eat out because it makes me sick. So I was explaining to my doctor, how can this happen if I don't really eat any fatty foods? Avocados have a lot of fat, and I was eating a lot of avocados, so I had to completely take that out and just kind of like really watch what I'm eating. So now I'm just like really paying attention to what I'm eating because I want to prevent another attack from happening.
So let's talk weight loss surgery regrets. If you've had weight loss surgery, then you may have experienced some of these regrets, or you may be currently struggling with them. If you're thinking about weight loss surgery, watch this video so you can have an idea ahead of time of what may come for you. Now I'm going to mention first a lot of the regrets that I hear from other people, and we'll talk about those real quick. And then I'm going to talk about regrets that I have and why I have those regrets. So the number one regret that I hear is that they regret it because they can't eat and drink like they did before. If you have an unhealthy relationship with food at all, this will be a regret that you will probably experience. This is one of the reasons that it is so important that you get any help with any eating disorder that you have or whatever unhealthy relationship with food that you have, that you get that under control before you have the surgery. Therapy is a must. Having the surgery does not cure binge eating disorders. Now, having the surgery will make it so that you literally can't binge eat, but you will try and you will make yourself sick or you will be extremely, extremely depressed. And that's one of the reasons that you have to have a psychological evaluation before you have weight loss surgery, at least in the US and if you're using insurance. I'm not sure about like self-pay places and overseas, things like that. So that's a physical or a psychological evaluation is a must in the United States and if you're going through insurance. Those are the only ones that I know for sure. But it is really important to get that done so that you can identify ahead of time where you may experience challenges and get help with that before you have the surgery. Number 2 is missing carbonated beverages. Once you have surgery, you can't drink those carbonated beverages, at least not right away. I think my doctor recommends like a year out or never. I don't know how realistic that actually is, but I mean, at least for the first several months, your stomach is not going to be able to handle it. You literally had part of your stomach cut out. It is healing from the trauma. Another regret that I hear is that it physically hurts to eat and drink. In my experience, from what I've seen from the people who have this regret, is because one, they might just be eating foods that their bodies just aren't quite ready for yet. Trying to eat leafy greens, a week out from surgery, probably not a great idea. Your belly's not going to be able to digest that very well. It's probably going to be painful. Eating rice a couple of months out may not be the best fit for your belly at the time. Drinking too much at one time is going to be painful. Your stomach is tiny now. It's healing from the trauma of the surgery. Now, this is not to negate at all what these people are feeling. Regret is regret. And it doesn't necessarily last forever either. You can regret it one day and then not regret it the next day. Part of this journey is the freaking emotional roller coaster that you are constantly on. Missing certain habits. So if you've always had the habit of, having a piece of cake every Friday night after dinner out with your husband, and now all of a sudden you can't do that anymore, it may not actually be the cake that you're missing, it might actually just be the activity of it. And that can lead to some regret. And I think that is totally valid. Feeling like you're missing out on things. Friends may not be asking you to go out anymore, go out to eat, or go out to have drinks because you can't drink alcohol for a little while after having surgery. And then, of course, there's always the risk of addiction transfer if you were addicted to food, before surgery. But friends may not be asking you to go out because they might feel bad that, like, they're going to eat and you probably can't eat that much. So then there's just that feeling of, like, you're kind of exiled from everybody.
Okay, so I just watched a video of a girl who's like 10 years post-op gastric sleeve surgery, and she's basically going on in the video saying how no one really explains the issues that you can have post-op gastric sleeve surgery. She said instead of planning like a mommy makeover or a BBL, she's planning getting her herniated disc repaired due to losing all of the weight with gastric sleeve surgery. Now, she goes on in the video explaining that she has a lot of joint pain, she has arthritis. Now, that is true. That was something I wasn't expecting, was how bad my arthritis was going to get after losing all that weight quickly.
Alright, so after watching those, I think it's pretty clear this isn't as simple as people make it look. Let's actually break down what's going on here, because there's a few different categories of problems, and I think separating them out helps you understand why this decision is so much bigger than people treat it. First, let's talk about the actual physical complications, because these are the scary ones, the ones that can honestly unalive you if they're not caught in time. A leak is probably the one that terrified me the most when I heard about it. Basically, when they staple your stomach into that new smaller sleeve shape, sometimes that staple line doesn't hold perfectly and stomach contents start leaking into your abdomen, and that is an infection waiting to happen, and it can turn into sepsis, which is life-threatening. Some people catch it early because they start running a fever or their heart rate goes crazy and something just feels wrong. other people don't catch it in time. And this isn't some rare 1 in a million thing. It happens often enough that surgeons warn about it, that hospitals have protocols for it, that entire support groups exist for people who went through it and survived. Then you've got strictures, which is basically when that new narrow stomach tube gets even tighter in one spot, almost like a kink in a horse. And when that happens, food gets stuck. Sometimes even water gets stuck. People describe it as eating and then immediately feeling like the food is sitting right at the top of their chest. And then they're throwing it back up because there's nowhere for it to go. Some people need a procedure where they stretch that area back out with a balloon. Some people need another full surgery. And this can happen once, or it can keep happening, becoming this recurring nightmare where every meal is a gamble. Reflux is another huge one. And honestly, this might be one of the most common complaints I see from sleeve patients specifically. Before surgery, a lot of these people never had heartburn in their life. After surgery, they're laid on antacids, sleeping propped up on 4 pillows, waking up choking on stomach acid in the middle of the night. And for some people, it gets so bad that the only fix is another surgery, converting the sleeve into a bypass, because the shape of the sleeve itself is part of what's causing the reflux. So now you're looking at a second major surgery just to fix a problem that the first surgery caused. And then there's the stuff that's less dramatic but still messes with your life every single day, like nutrient deficiencies. Your stomach is so much smaller after this surgery that you physically cannot eat enough food to get all your vitamins and minerals the normal way. So people end up needing to take handfuls of supplements every day for the rest of their life. B12, iron, calcium, vitamin D, protein powder just to hit basic protein goals. And even with all of that, some people still end up anemic, still end up with bone density issues down the road, still end up needing IV infusions because their body just isn't absorbing what it needs. And that's not a 6-month thing. That is forever. That is something you manage for the rest of your life. Every single day, checking labs, adjusting supplements, dealing with doctors who sometimes don't even fully understand the long-term effects, because honestly, the long-term data on some of these procedures is still catching up. Gallstones are another one that catches people off guard. When you lose weight that fast, your body processes fat differently, and it becomes way more likely that you'll develop gallstones. So a good number of people end up having their gallbladder removed within the first year or 2 after bariatric surgery, and it's almost treated as a footnote, like, oh yeah, that happens sometimes. But if you're the person going through it, that's another surgery, another recovery, another way your body is adjusting to a completely different way of processing food. Now, let's get into the stuff that isn't as talked about, but honestly might be the heaviest part of this whole conversation, and that's the emotional and psychological side. Because losing weight fast doesn't automatically fix your relationship with food or your relationship with yourself. For some people, it actually makes things more complicated. There's this thing called addiction transfer that gets brought up a lot in bariatric communities, where people who use food as a coping mechanism suddenly can't use food that way anymore because their body physically can't handle large amounts of food, so that coping mechanism shifts somewhere else. Alcohol is the big one, and what's wild is that after this surgery, your body processes alcohol completely differently. People who used to be able to have a couple of drinks and feel fine are getting drunk off half a glass of wine, way faster, way harder. And for some people, that turns into a real problem because the tolerance is gone, but the urge to cope is still there. Shopping, gambling, other things too. It's like the weight was never really the whole issue. It was a symptom of something else. And if that something else doesn't get addressed, it just shows up in a different form. And then there's weight regain, which honestly might be the most common regret I see people talk about. People go into this thinking it's permanent, thinking once the weight is gone, it's gone. But the truth is, a pretty significant number of people regain some or even a lot of their weight over the years, especially if they don't fully change their relationship with food and exercise, or if their stomach stretches back out over time, which can happen. And I think this is where a lot of the deepest regret comes from, because if you're going to go through all of this, the surgery, the recovery, the risk, the lifestyle changes, and years later you're back where you started or close to it, that's devastating. And that's not just physical, that's a huge emotional blow. People feel like they failed, even though realistically their body did something totally normal, which is try to get back to its natural set point. But in the moment, it doesn't feel like biology, it feels like personal failure, and that's a really dark place for a lot of people. Loose skin is another thing people don't prepare for enough. When you lose a massive amount of weight, especially quickly, your skin doesn't just snap back like a rubber band. For a lot of people, there's excess skin hanging off their arms, their stomach, their thighs, and it can be a lot. Some people describe it as feeling like they traded one insecurity for another. They wanted to feel confident in their body, and now they're dealing with skin that gets irritated, that's hard to hide, that costs thousands and thousands of dollars to surgically remove if they even want to go that route. And that's often not covered by insurance because it's considered cosmetic. So now you've done all this work, spent all this money, gone through all the risk, and you're still not at the place you imagined yourself being. And I think the social side of this doesn't get talked about enough either. People's relationship change after this surgery, sometimes in ways they didn't expect. Some people say their friends or family treat them differently once they lose weight, better in some ways, but also almost resentful in other ways, like there's jealousy hiding under the surface. Some people say strangers judge them for taking the easy way out, which is honestly ridiculous if you actually understand what this surgery involves, but that judgment is real and it hurts. And then there's the flip side, people who feel guilty, like they cheated, like they didn't earn their results the right way. Even though there is no right way, there's just what works for your body and your life. So when I put all of this together, I don't think the conversation should be bariatric surgery is good or bariatric surgery is bad. I think it's way more nuanced than that. For some people, especially people whose health is in immediate danger because of their weight, this surgery can genuinely save their life. That's real, and I'm not going to sit here and pretend it isn't. But I think the way it gets marketed, especially online, skips over so much of what we just watched in those clips. It skips the leaks, the strictures, the reflux that never goes away, the nutrient deficiencies you manage forever, the addiction transfer nobody warns you about, the weight gain that feels like a personal failure even when it isn't, the loose skin that costs more money to fix, the relationships that shift in ways you didn't see coming. If you are considering this surgery, or if you know someone who is, I think the most important thing you can do is go with your eyes fully open. Ask your surgeon about all of this, not just the numbers on the scale. Ask about the revision rate. Ask about long-term nutrient management. Ask about what percentage of patients experience reflux or regain. Talk to people years out from surgery, not just people in their first 6 months when everything feels like a win. Because the truth is somewhere in the middle of the highlight reel and the horror stories. And you deserve to make this decision with the full picture, not just the parts that make for a good before and after post.
The farts are a thing after VSG, so let's talk about it. This doesn't happen to every single person, but for a lot of us that have had bariatric surgery, VSG to be specific, because that's the surgery I had, the farts be a problem, I'm not gonna lie. And when I say a problem, sometimes the problem is that they smell really bad. And that's the case sometimes not so much, but regardless, the farts are frequent and sometimes they are very, very loud. And it is definitely more increased than they were prior to surgery.
That's it for me. If you made it this far, I appreciate you watching. Creators' handles are in the description box below, so go give them some support. Otherwise, thank you so much for watching, and I'll see you in the next one. Bye.